Nurse practitioners are vital to healthcare in the United States. What sets nurse practitioners apart from other healthcare providers is their unique emphasis on the health and well being of the whole person. They add their special touch to many different arenas of healthcare as certified nurse midwives, acute care nurse practitioners, clinical nurse specialists, primary care nurse practitioners, and certified registered nurse anesthetists. Today, our group is honoring the unique role of the certified registered nurse anesthetist. To understand this role, we are going to be doing a recap of what it took to get where they are today. Nurses have functioned in roles as anesthetists long before there was a title for them. During the American Civil War, lay women had volunteered to help with the war efforts. Some of them assisted in surgeries by providing anesthesia with chloroform. The first nurse anesthesia education was offered in 1909. These early nurse anesthetists proved their value in many venues, eventually receiving pushback from some physicians, stating these nurses were practicing medicine. A landmark decision affecting all nurse practitioners occurred in 1917 and had come from the practice of nurse anesthetics deeming it legal but subordinate and required oversight by physicians. Reimbursement for nurse practitioners has also not come easy, as it was not until 1989 when CRNAs were the first nurse specialists to receive direct reimbursement for their services. The CRNA role is specific to surgery. Their role extends from the pre-anesthetic preparation and evaluation to induction, maintenance, and emergence from anesthesia, to post-anesthesia care, and finishes with peri-anesthetic and clinical support functions. This makes their role more rigid than other advanced practice providers, and the healthcare team that they will be working with includes physicians, surgeons, dentists, podiatrists, anesthesiologists, and nurses. Their scope of practice includes 5 domains listed as preoperative, pre-procedural, intraoperative and intraprocedural, postoperative and postprocedural, pain management, and other services. All of these are dictated by the American Association of Nurse Anesthesiology. As of January 1st, 2022, any student entering a nurse anesthesia program must be enrolled in a doctoral program. Master's degrees are no longer acceptable. Students who complete nurse anesthesia programs must pass the certification exam from the National Board of Certification and Recertification for Nurse Anesthetists. Recertification includes 100 hours of continuing education. According to the American Association of Nursing Anesthesiology, the CRNA standards apply where anesthesia is provided, including but not limited to the operating room, non-operating room and anesthetizing areas, ambulatory surgical centers, and office-based practices. The CRNA standards apply where anesthesia is provided, including but not limited to obstetrical anesthesia, diagnostic, therapeutic, and pain management. As a CRNA, you'll be expected to provide patient-centered care, including respecting patient autonomy, dignity, and privacy, supporting patient needs and safety, obtaining informed consent for anesthesia care, and communicating effectively with patients and their family and caregivers. Also, you'll be expected to have a comprehensive patient assessment, including performing a thorough pre-anesthesia evaluation, conduct an anesthesia-focused physical assessment, and formulate a patient-specific anesthesia care plan. And then you'll need to be good at your documentation and communication, and those include maintaining accurate, timely, and complete anesthesia care records, communicating effectively with the healthcare team, and transferring care appropriately, ensuring continuity. Another competency and standard of care is equipment proficiency, including conducting appropriate equipment checks, verifying equipment function before each anesthetic, and operating equipment safely to minimize risks. Next is patient management and monitoring that includes implementing and modifying anesthesia care plans as needed, continuously assessing patient responses to anesthesia, monitoring oxygenation, ventilation, cardiovascular status and temperature, And the next part that is important to you is safety and infection control, and that includes adherence to infection prevention and control policies, participation in a culture of safety, and collaboration with interdisciplinary teams. The next part of this slide is professional development and well-being, and those include participating in ongoing quality improvement processes, maintaining physical and mental wellness, and engaging in lifelong learning and skill development. According to the Pennsylvania Association of Nurse Anesthetists, these are the current competencies for CRNA practice. The registered nurse has successfully completed a program of a School for Nurse Anesthetics accredited by the Council on Accreditation of Education Programs of Nurse Anesthesia of the American Association of Nurse Anesthetists. Number 2, the RN is certified as a registered nurse anesthetist by the Council on Certification. After completion and certification, the CRNA must possess the following competencies. Graduates acquire knowledge, skills, and competencies including patient safety, peri-anesthetic management, communication, and the competencies needed for professional responsibility. These competencies must include, though they are not restricted to just these, central and arterial line insertion, including, when appropriate, the use of ultrasound guidance, obtaining, interpreting, and intervening on arterial blood gases, intubation and advanced airway management, ventilator management and troubleshooting, dosing and administration of sedation for mechanically ventilated patients, management of paralytic drips, and finally, CRNA competencies also include maintaining and monitoring invasive lines, vasopressor selection and management, intravenous fluid and blood administration, ventilator weaning, extubation, and post-extubation evaluation and care. Issues for CRNAs are burnout. It's a very stressful position, and you are responsible for this patient's life. A lot of times they're in a traumatic situation, and it just is a intense job for these CRNAs. And staffing shortages, we're going to talk more about that in a little bit, but there is not enough CRNAs, and so they're pushed to work more, and there's not people that can fill in for them often. And another issue is independent practice. In a lot of states, they have opt-out where the governor can decide to have an opt-out for them to practice independently without physicians supervision, and we'll talk more about that in just a minute also. So the future of the CRNA role is that there is an increasing demand for CRNAs, but an even greater shortage. There will be a change in the landscape of doctoral prepared versus master's prepared CRNAs due to the change in enrollment criteria. And a huge change that began in 2001, and this is where we're talking about the opt-outs, it's that the state governors were allowed opt-out policies which remove physician oversight requirements for Medicare billing purposes. And so far, 25 states have chosen opt-out policies. So, in summary, there are many benefits to working as a CRNA when one is considering becoming an advanced practice nurse. With the positive reputation this profession has developed over the course of its existence, becoming a CRNA should be an attractive consideration for the critical care nurse. While it requires planning when considering career development as the RN, it is projected to be a fast-growing area in healthcare with many more opportunities for growth within the foreseeable future. Rural places of work are expected to be an increasingly favorable place to develop the CRNA career with a greater demand, pay, lower costs of living, greater autonomy, diverse caseloads, increased job satisfaction, and additional incentives such as loan repayment. While it requires a background in critical care prior to entering a program, the possibilities are vast upon completion of the CRNA program and a great option for further advancement.